Crises and Disasters, Chapter 26. There are various characteristics of crises. One, there could be a disturbances in one's equilibrium. There may be a person may fail to function as usual. There's a disruption in equilibrium. A person, again, individual may develop a crisis due to stressful events or a threat. Also, there are some factors. So, individuals sometimes they perceive that there's going to be a event, and it never happened. It never come to fruition. A person may have inadequate situation support. They do not have adequate coping mechanism. So again, these are in order to be successful, again, they must have support that they need. They must be able to cope. And this is where we come into play, our healthcare providers helping these clients progress through and helping them to identify a positive coping mechanism. This is a case study that we will discuss as we go through um, tomorrow's lecture. These are basically some crisis theories here, um, and we're going to talk about some of the theories in just a second. Namely, as we talk about maturational crisis, this is based on Erickson. It's basically a conceptual development occurring through the 8 stages in life. And if you go look at Erickson stages, developmental stages. Uh, so again, whenever a person they fail to progress through those stages of development, they may develop or go through a crisis. For example, alcoholics and drug addiction disrupts progression through the maturational stages. So again, based on their habits, it could delay progression through Erickson's various stages. They may regress, or like I said, they may never get to their progress through the stages of development, according to Erickson. Their old coping skills no longer effective, which leads to when a person coping mechanism, when those mechanisms fail, it can lead to tension and anxiety. So again, this is maturation, meaning that they do not develop according to through Erickson, based on Erickson's theory. Then there's another crisis event, a situational crisis. It arises from unusual distressing, unanticipated. Some examples of situational would be loss of a job, death of a loved one, changes in the financial status, a psychiatric or physical disorders or illnesses, divorces. These are all situational crises. Okay. Then you have adventitious crises. This basically things like natural disasters, earthquake, fires, um, floods. There are also human, could be one-on-one violence, active terrorists, wars, riots, shooting, bombing, and things of that sort. Accidental, again, airplane crashes or airlines, structural collapses, nuclear power failures. There was a question on the exam once. We were looking at the difference between the different crises, adventitious versus situation. And I think it was basically talking about an individual that was in a house, lost their house, so as through a house fire. So as you can see here, a good example of that house fire falls on adventitious crises. As we there are different stages that one go through during a crisis situation. As we know, as anxiety level increases, the first thing we do, you think about the fight or flight. Our anxiety level goes up, our heart rate goes up. It stimulates us. Then sometimes we get to the point our defense mechanism kick in, and then we fight, we fight, we fight. So sometimes the clients may make it through. It's fight or flight, and so as the initially they shocked. Okay, so when your heart rate initially with that first initial shock, I'm sorry, everything goes up, the heart rate goes up. And if you can't make it through that's different to, fight or flight, you can't make it through, then your heart rate, again, it goes down, it's going to drop because all your defense mechanism fail at that point. Then when the defense mechanism fail, also there's a threat. That threat persists, it continues. If you don't, it is steadily goes up, producing feeling of extreme discomfort. The client become very disorganized. This is where we go through trial and error. We're gonna try to make sure to see if this mechanism works. This is so we go through trial and error trying to problem solve during this phase. And then phase three, if the trial and error fails, okay, it didn't work. What we did, it didn't work. The anxiety is going to continue to escalate. These clients can become panicked. They become severe. They get to the point, like I said, they withdraw because they fight. They can't continue to fight. So the autonomic release behavior mobilizes. Um, these clients may get to the point at this point during this phase right here. Like I said, everything becomes extremely uh, very, the clients become very severe. They may have, again, the blood pressure goes up, heart rate continue to goes up. At this point, they can't resolve, so they go on through that fourth phase. At this point, the coping mechanisms, they're very ineffective. These clients become depressed, they become confused. At this phase, these you have to particularly watch these clients for suicidal, or they may not only hurt themselves, they could be in a position where they hurt someone else also. So stage four, sometimes these clients get to the point they may have to be hospitalized. They come in, you may present to the emergency department, hyperventilating, panic attack. Then this is where we have to run tests to determine whether or not it's physiological, psychological, and make that determination. And then if a client heart rate continually up, they're hyperventilating. This is again we have to treat them medically. Get the physiological issue that's under control. And we'll continue to talk about this case study tomorrow. Um, And again, as we go through caring for the clients that develop in a crisis situation, again, same old nursing process. We're going to assess the client's perception of the event. What support do they have? What coping mechanism do they work? Are they ineffective? These clients are at risk for impaired coping. Also, they may have impaired coping. It may be actual family coping or risk for, again, anxiety level. Um, our plan here, we definitely need to put in some safety intervention. Patient safety comes first. We're trying to reduce that anxiety. It may be talking to these clients, maybe medication to get that anxiety level down. Because if they continue, that anxiety level continue to escalate, they become hemodynamically unstable, meaning that the blood pressure is going to continue to rise, the heart rate is going to continue to rise, and they can go into cardiac arrest. Or respiratory failure from hyperventilation. So appropriate level of prevention debriefing, it would be very important at this point. So we want to again collect our data, uh, assess the client perception of it, and determine what coping mechanism will work for this client. So ineffective coping could be things like um, drinking alcohol, yelling, fighting, overeating, smoking. These are all some samples of examples of um, ineffective coping mechanisms. So these are some things we can ask the client. What have you been doing to relieve the anxiety? What have you been doing to relieve the anxiety you have been feeling? What has helped in the past? What has really helped in the past or relieve your stress? So we're going to go back and see will those mechanisms work. Um, you know, again, what support do these clients have? Primary prevention, again, we want to promote mental health and reduce mental health due, due to decrease in the incident of a crisis. We want to prevent it from happening in the beginning. Okay, so again, secondary the event has occurred. Now we want to prevent any prolonged anxiety. So to keep these clients from going into the tertiary phase where they again they we're going to provide long-term support for these clients who have developed a crisis. So we try to prevent, then we try to catch them in the secondary phase to keep them from going through to tertiary phase. Okay, there's a tertiary tool prevention tool that your book talks about. It's a 7 phase group meeting process, meaning that they have to go to constantly going through the phases. Those group meetings or counseling sessions. Okay. Some examples of that what we can do in the session, we can do things like debriefing the client. Um, also, debriefing rescue and help with the healthcare workers who have responded to natural disaster. Meaning that debriefing that you've gone through a crisis. So at this point, particularly for instance, like there's an incident that may have happened in a hospital. I'm using that for an example. So we debrief. We're gonna go do the debriefing process. What did what went right and what went wrong? So we want to know what went wrong. So if what went wrong, we want to. This is where you're going to see policy changes. It's the same thing with clients. Their coping mechanisms. If this coping mechanism didn't work, you usually, you these clients may usually implement or they, be able to cope with their stress or crises, and it didn't work. It's not working anymore. So we have to look at new coping mechanisms, new strategies to help these clients. Okay. Treatment modalities. Again, the emergency room is not an ideal place to treat these clients unless they have a physiological problem. These clients would definitely they could benefit from outpatient um, uh, treatment modalities, behavioral crisis care hotlines, crisis intervention teams, warm lines, crisis stabilization facilities. But it's not, like I said, it's not the ER is not the place for to treat these clients. As we go back, as we talk about debriefing, I'm gonna go over tomorrow in detail. We'll talk about the critical incident stress debriefing. Is an example when we talk about the tertiary prevention, and that is CISD, Critical Incidents Debriefing, Stress Debriefing. Basically, it consists of a seven phase group meeting that offers the individual the opportunity to share their thoughts and feelings. So it's a seven step process. So again, as we talk about it, they go through that introductory phase. They meet. They talk about the overwhelming um, issues. It's confidential. They answer the team members are identified. They ask questions. Then the facts phase. This is where the participant discuss the facts of the incident. They introduce themselves. Then the thought process. This is where the client starts sharing their thoughts and their concerns. And then their reaction phase is where the participant asks about the worst thing about the incident. Okay, we were asking them, we're debriefing them. Okay, you went through this crisis, now we're going to debrief you. And then what symptom did you have? This is the symptom phase. How did you feel during that going through that crisis, the initial experience? Then we teach them the teaching phase. We teach them, we provide guidance, uh, stress management techniques in the teaching phase. And then the reentry phase, this is where the participant review the material, discuss, we debrief, we talk about it. We reassure, we provide written material. Then this is where we can refer our clients to support groups. Okay, so it's called the CISD, Critical Incident Stress Debriefing tool. Um, let's talk about global disasters. And basically, this is on a larger scale. Things like hurricanes, fires, pandemics, disaster preparedness. Uh, basically, when there's a disaster, that's what happens. We assess or access our local levels first, meaning your city. And then if the city doesn't have the resources, then we extend our we reach out for further assistance. We network. We have made reach out to the county. Then we go to the state. And then if the state is not big enough to handle the pandemic or the disaster, then we go to the national level. So we start at the local level first, uh, seeking support. Um, there's FEMA. It's going to be at the federal level. This FEMA respond, like I said, it's a forced phase disaster process. Um, like I said, this FEMA is at the federal level. It's not at the local level. Uh, they go in. They manage through what we call. They go through mitigation, preparation. Mitigation is basically the attempt to limit a disaster. They're trying to limit it, keep it from becoming a wider spread. So reduce the cause, the impact, and the consequences. So they try to mitigate to again try to keep it from becoming very severe. And then preparedness. This is where our plan is in place. And I was telling the students the other day, emergency preparedness. There's a plan. If whatever facility you're going to work in, there's going to be a emergency preparedness plan. So again, we don't expect you to, the organization do not expect you to memorize it verbatim, but you need to know where the plan is located. And then there are drills that are being held periodically, also to make sure to drill to make sure that the staff knows what to do in the event that there is a disaster. Okay, and then the response team. This is basically during this phase, person, but depending on where you're working, I know if you're working in a public setting like the Department of Public Health, you're gonna automatically be on a plan, be on the response team. You get if there's a disaster, you get activated, um, and have to go out and help the communities. Okay, and then recovery. This is where we go and trying to restore, get the community back, or the organization, wherever the disaster occurred. So they basically go through mitigation, preparation, response, and recovery. Homeland Security. It's a local emergency response professional. Again, they help out. They come and help the community at a local level. They help the local level. They'll come down. They'll send resources. Department of um, Homeland Security. Then you got the National Incident Command System. They coordinate first responders, meaning that if you want to be a volunteer first responder, there's particular training. It's an incident command training that one have to go through. But this again, the national um, incident command system. They, like I said, they coordinate first responders, and they also train them specifically how to handle a disaster. Um, let's see. And again, another responsibility of DHS is they make sure that we have all the resources, that they are immediately available and accessible, so that to meet the needs, help with preparedness, response, and recovery. There are protocols that the Department of Homeland Security has implemented uh, from a national level. So again, like I said, um, uh, they make certain that the responders that go out, that they have what they need. They have the training that they need before they go out into the community. So again, these are just some resources that are available for for um, for the communities if there are crises. Like I said, whether it's on the local level, or whether it's a national level. Again, the resources are available. Uh, So with that being said, this pretty much all I'm going to cover on disaster. But we'll talk about we'll go. I definitely want to take you through some examples tomorrow in class, so you have a better clinical picture. With that being said, this ends the recording for this PowerPoint.